If you think about like this futuristic healthcare where you're in your home and able to determine if something's going wrong in the comfort of your bathroom on your body composition scale with a blood pressure cuff on, that is the future that we all hope for. And this is a way that we can get that data to providers and from patients pretty easily. I always knew I was going to be in the health profession. I grew up with watching my mother. She was a nurse. She was a great caregiver. I decided to get my master's as a nurse practitioner. I wanted to get into primary care to be able to help prevent illness and disease. And the traditional medical system was just still broken. I was having trouble helping people before they became ill to be able to really make the impact that I hope to make for folks. And that led me to pursuing a career in precision medicine to be able to empower people to make changes via lifestyle, and particularly biometric tracking and follow-up and kind of N of 1 studies that I wanted to be able to make informed decisions based on their data and the criteria that would actually help them make improvements. So before using Heads Up, I mean, if you think about the different areas of data that you want to track and integrate when you're working with someone on a precision medicine basis, you really want to understand their wearable data, whether it's an Apple Watch or an Aura or Whoop or whatever. Next, you may be interested in their metabolic health. So then you're using a Dexcom or a Libre CGM. The list keeps going, right? There's a multitude of devices and platforms. For the practitioner, it becomes very problematic. There was a lot of friction in a lot of different areas. Communication is obviously an issue and a problem. You want to have people being aware of what data you're looking at and have that readily available to them, whether it's a note or their actual biometric data, their lab data, their prior reports. So having a place like Heads Up where I can see that data, being able to combine all the labs into structured data and generate reports in a way that is relatively seamless has been very helpful. You're not just looking at lab values, you're looking at other microbiome markers, you're looking at epigenetic aging, and you want to trend those over time. So I think the lab feature of creating structured data from various reports has been a huge help. Just simply the fact that I'm able to feel confident that I have all of that patient's data and information readily available going into that call. I know that I can prepare for the call in a shorter amount of time and be adequately prepared. The improvement over a typical EHR has been pretty vast for us. Signals has been really helpful in being able to see whenever someone is falling outside of a desired range, having an immediate response where we're able to be proactive. It increases not only client engagement, but it increases, improves outcomes for that individual. I've gotten feedback from clients that using the platform has been a new experience for them in healthcare. Even our clients that are, used to concierge medicine, they're still surprised and delight. I find that there's a lot more buy-in on the client side from being excited about what numbers we're trying to change and why, because it's so readily available for them on the mobile app or the web portal. The engagement's just higher that way. Heads Up has the technology that allows practitioners that are looking to be preventative to do what they want to do. The ability to be proactive comes from understanding whenever there's just a small signal that is starting to show up, and generally speaking, you're not going to have that information in front of you, right? The fact that it's so simple to have that data in front of you and readily available, and then to be notified, it's exactly what we're looking for. I would definitely recommend Heads Up. I think there are many practitioners in the precision medicine or functional medicine space that are looking for a platform that serves more needs. A lot of times you're piecemealing like 4, 5, 6 softwares together to get what you need out of them. Heads Up can take the majority of those away and really serve your patients adequately but efficiently. It's been quite impressive to see how much Heads Up could replace from that standpoint. And I would definitely recommend it, to other practitioners.